Hey, it's Dr. Amit Kamat, prosthodontist at Innovative Dental Orthodontics here in Oviedo, Florida. And I wanted to spend some time talking to you about dental implants. We get a lot of questions on our phones and in person about what is an implant, is it right for me, and like how do they work? And really, I wanted to spend the time to almost like demystify all the stuff that you hear on the internet, marketing on TV, and just from talking to people. The first one I want to start talking about is just a single implant. The single implant for that patient that's thinking about replacing one missing tooth. And as you know, that for that one patient that's missing that one tooth, there's a solution of a bridge, which you alter adjacent teeth to fill that gap. Well, an alternative would be that implant, the dental implant. And for those patients that are thinking about the single dental implant, what that entails is first meeting you, wanting to check your medical history, making sure there's enough room for an actual implant, and the part that goes on the implant, which is the implant crown. And what that implant looks like, it's something similar to this, which is typically placed in the bone below the gum tissue. You don't even really see it unless you saw the x-ray. And then after a few months of healing, we then put the part that you are actually wanting is the tooth, the part that you see. And that's the dental implant crown that goes onto what we call an abutment. It interfaces between the actual prosthetic crown to the implant, and it's held in by that prosthetic screw. So obviously the crown doesn't come off. And so that's a great solution for that patient that's looking for that single tooth replacement solution. Now the next solution is, well, what about for those patients that are missing all their teeth or have just a few teeth and they know they need to let go of those teeth? Well, we have that solution called our full arch solution. But what's tough is there's so much information, good information, not so good information about those solutions. So I thought I'd start off with the simple solutions and work our way to the more advanced solutions. So the first solution for the ones that actually have lost all their teeth, as they know, is dentures. And you know, some dentures, they're quite old, they don't fit as well, they're a little loose. So typically those patients maybe just need a new set of dentures, right? A new top denture and a new bottom denture. But what I hear a lot from my patients where they're thinking about getting a new set is, doc, you know, my lower denture doesn't stay put, it moves all around. And so fortunately, we do a procedure called denture stabilization, which is truly a game changer for those patients because it helps them keep the denture in their mouth so they can actually eat more efficiently and eat the foods that they want to eat at the restaurant and not the foods that they have to eat at the restaurant. So with those solutions it typically consists of 2 implants or even 3 implants on the bottom where they literally clip the denture in. So imagine wearing something where it's not rolling and rocking in your mouth so you can actually chew into something more comfortably. And those patients are just truly happy because of that procedure called denture stabilization. Now another procedure that we do to add to a really good thing, in addition to the lower denture being stabilized, is the upper denture. It usually consists of 4 implants where we make them a horseshoe denture that does not cover their roof or mouth. It's a palateless denture, which is truly an awesome solution because they can snap it in, eat way more efficiently, taste the details of their food when they're at the restaurant, and truly just improve their quality of life. And so that's a denture, like we said, is assisted by 4 implants clipped in, and then every night, top and bottom, you can detach it, clean it, so you make sure hygiene is done well and things just feel and smell a lot more healthy, so you have nothing building up under there. Then the last solution that a lot of people ask us about is the all-on-4, all-on-5, all-on-6, and that solution truly is what a lot of people ask us about, that have a lot of missing teeth or no teeth and are like, I need all-on-4, I need all-on-5, I need all-on-6. And the truth is, what you're asking for is you want something that does not come out, that's fixed, that feels as close to the real thing as possible. And when we do your consultation, we try to figure out, do you need 4 implants? Do you need 5 implants? Do you need 6 implants? It all depends on the availability of bone. It depends on how much bone there is. How much bone do we need to remove to make room for all this hardware? But what you're really asking for, if you're looking for a fixed solution that does not come out, that does not detach, is a fixed and implant supported solution. And that's where you have either 4 implants, 5 implants, 6 implants, where that prosthetic solution is screwed in. Now, when it comes to maintenance, you have to do your part. So every night with bridge flossers, a water pick, you're pulling your lip down and you're flushing all that stuff out. But the truth is, you will need to see us once a year to physically take this thing out and clean it really well for you once a year. In the end, my team and myself want to meet you. We want to figure out what your goals are. We realize that everybody wants to eat more comfortably, smile more confidently, and figure out what will actually fit their budget, because a lot of this stuff is confusing, but when it's brought down to being more understood and trying to meet that specific patient's needs, it's actually not that confusing. So my team and I would love to meet you. I am Dr. Amit Kamat, prosthodontist at Innovative Dental and Orthodontics. Thank you.